And we're recording. We're going to measure a range of motion of the shoulder. We're going to start out measuring glenohumeral flexion. And what we first want to do is just look at the gross motion and assess that before we measure with the goniometer. When we measure with the goniometer, the patient is supine. Typically the knees are bent, so we can bend the knees up a little bit to make the patient a little bit more comfortable. The axis is the lateral aspect of the greater tubercle. The proximal arm is parallel to the midline of the axillary region right there, and then the distal arm is lateral to the midline of the humerus, and you use the lateral epicondyle as your reference. So what you would do is have the patient move, and let's say he has that much range of motion. We'd go lateral aspect of the acromion, the midline of the thorax, and then we'd go along the midline of the humerus using the lateral epicondyle as the point of reference, and then we measure the motion there. All right. Next, we'll do in this position, we'll do internal and external rotation of the shoulder. So when you're doing internal external rotation, have the patient move just a little bit over, and you may want to use a towel roll to get the arm in a neutral position. Again, you'd want to grossly look at external rotation and then internal rotation. And then you'd want to measure using the goniometer. So what we're going to do is we're going to go use the olecranon as the axis. So our axis will go on the olecranon. And then we'll go, the proximal arm will be perpendicular to the floor. And then when we have him do the motion, we'll go into internal rotation, making sure his shoulder doesn't pop up. And he stops there. And then the distal arm is along the midline of the forearm, where the ulna is, and then using the ulnar styloid process as your point of reference. And then you can measure the motion there. And then go into external rotation. All right, parallel, using the olecranon as the axis, parallel to the floor, and then along the ulnar border, and using the ulnar styloid as a point of reference, and measure there. Next, we'll do extension. So with extension, now we're doing the opposite arm. And what you want to do again is grossly look at extension. Great. And this is going to be the same as flexion, so the same landmarks. So you use the lateral olecranon, you use the midline of the thorax, and then the midline of the humerus, with your lateral epicondyle being your point of reference. Measure there. Great. And then last is abduction. So the standardized position for abduction would be lying down, but for demonstration purposes and for doing it so we can video, we're going to do it in sitting. This would be an alternative, but the landmarks would be the same. You're going to the anterior area of the acromion, and then you're going to be parallel to the midline of the thorax, and then you're going to go up into abduction, and let's say he has that much. So you want to make sure you stay parallel, you want to make sure the patient doesn't substitute, and then you want to go down the midline of the humerus, and when you're doing that, you want to use the medial epicondyle as your point of reference.